We now have a panel discussion themed on Starting Now, a new paradigm for science and health. And I want to introduce the moderator, Harold Neidhart, CEO and curator at Future IO Institute. Harold has grown an influential faculty and think tank of innovators, futurists, and thought leaders. And this is a new platform and community for global innovation leaders to help co-create that vision for desirable futures that Harold, you so wonderfully champion. Harold is also an advisor to the UNFCCC Resilient Frontiers Initiative, a Singularity University alumni, and a keynote speaker on sustainable innovation at many international conferences. Indeed, we've actually been on many agendas together, but we've never had the pleasure of meeting. Harold has also published 5 books. How do you find the time? Most recently, Leadership for Sustainable Futures. Please welcome him to the virtual stage. It's all yours.
Thank you so much for the kind introduction, and welcome everybody. I have the pleasure to moderate now the next session, and we're talking about AI, obviously in the health sector. Now, let me introduce our speakers and panelists and my guests today. So we have Cristina Campero. She's the CEO of PROSPERiA. Hi, Cristina. We will welcome Elizabeth Gibson, Director of Analytics Solutions at Elsevier, as well as Rose Nakasi, a PhD researcher of computer science and AI and data science lab at Makerere University, Uganda, and chair of the topic group AI-based detection of malaria. Thank you so much, everybody, for joining us today. And let's all get to know you and your thoughts and your backgrounds and all the amazing initiatives that you launched. So why don't we start with a small introduction for everybody? Please let me know, please introduce your organization and what are you working on right now as a brief introduction. Let's start with Cristina.
Thank you very much, Harold. Very happy to be here. My name is Cristina Campero, and I'm the CEO of PROSPERiA. PROSPERiA is a Mexican health tech company focused on democratizing access to healthcare through technology and particularly through artificial intelligence. Our first products are focused on preventing blindness through machine vision analysis of iPhone those pictures. And last year, we also launched a new telemedicine platform in which we are incorporating several AI features to make, again, healthcare more accessible for the Mexican population.
Fantastic. Very short and sweet. And we dig deeper, obviously. Rose, can you share a little bit about your organization and your main initiative right now?
Thank you very much, Harold. And thanks for that kind introduction. I'm a lecturer at Makerere University, and I'm a computer scientist. From there, we have just recently won the AI for Global Goals challenge that is funded by Google. And in this, our signature project, Ocular, we are currently working on automating microscopy disease diagnostics, and specifically we're looking at diagnostics for malaria, cervical cancer, and tuberculosis. And recently, we've also launched the Makerere Artificial Intelligence Health Lab to be able to democratize and harness the use of artificial intelligence to support healthcare systems, especially here in Uganda. Thank you very much.
Thank you, Rose. Fantastic. Over to you, Elizabeth.
Hi, Harold. Thank you so much for having us. It's a pleasure to be here today. I'm joining you from Elsevier. We're a global information analytics company. I'm the Director of Analytics Products and here to talk to you about Scopus AI. Scopus AI helps members of the academic community, particularly researchers, enhance their understanding of new topics and reach insights in those areas with unprecedented speed and clarity. It was built in close collaboration with the academic community, and it's grounded in trusted scholarly content vetted by subject matter experts worldwide. The trust element is something that folks have come back to again and again today, so that's really, really important for us. And because it's built on this trusted content, it can serve as a trusted guide through the vast expanse of human knowledge found on Scopus. And Scopus, for those of you who don't know, is the world's largest multidisciplinary trusted abstract and citation database. So it's used every day by researchers all over the world as they ask questions like, what's going on in my field? Who are the top experts? What are the major publications? And where should I publish if I want to make the greatest impact? Who should I collaborate with? Who are the top performers? And much more to help them advance their research and advance their careers. So we'll tell you a bit of our story and how we're impacting users today. But before we dive into that, I just wanted to take a moment to acknowledge the bigger picture. We looked at a researcher team who was investigating how we could come together as researchers to address grand societal challenges like the SDGs. And they found in their work that realizing the SDGs requires solutions-oriented interdisciplinary research. However, compared to disciplinary practice, so focusing on one specific area, which academia happens to be quite optimized to do well, interdisciplinary research so far remains under-researched, under-theorized, underdeveloped, and under-supported. So in alignment with our mission of helping researchers and healthcare professionals advance science and improve health outcomes for the benefit of society, we were particularly interested in disconnects like these. We believe that making things easier for individual researchers, one search at a time, when scaled across researcher teams across the globe, can become a part of that broader fabric of improvements that help us address grand societal challenges like hitting our SDG goals.
All right. Okay. We will dig deeper into this as well, but thanks you for the brief overview of all your works. Before we have like general questions and engage, I want to, let's say, just have follow-up questions for what you introduced. And for Cristina, let's start with you. So what do you think is the reason for your success? And maybe also start with, so the reason for the success, and maybe combine it with your mission. So I sometimes feel that the more people are aligned with their mission and their purpose, then this leads to success. But this might be another case. So, what do you think is your success recipe?
Yeah, thank you. That's a great question, and I think the point that you mentioned is certainly very important for us. I think it's very linked to our mission. Is that since we set up PROSPERiA 4.5 years ago, we set the mission of really being able to use artificial intelligence to democratize access to healthcare. And therefore, we started thinking, okay, what's the biggest concrete problem that we can tackle within Mexico? And for us, that was early detection of diabetic retinopathy, because currently diabetic retinopathy, that is this blindness that is caused if you live with diabetes because of high concentrations of blood sugar in the body. This right now is the first cause of disability in Mexico. So it's a very big problem, and it's a very big opportunity to be able to use technology to be able to screen repeatedly the patients that live with diabetes and be able to refer them on time to the ophthalmologist so that they can have a timely treatment and diagnosis. So I think for us, our recipe of success, or the path that we're following towards that, is really being able to create technology that will have an impact on people's life and actually is addressing a problem in the healthcare ecosystem in Mexico. Because for us, I think, yeah, of course, we have great algorithms with great precisions, but if you don't have the right partners and if you don't have sort of like the commercial and medical know-how for these algorithms to be able to reach people, then it's very hard for you to actually be successful.
Great. Rose, I've been in Uganda, unfortunately, last time only in 2019, but your big, beautiful country is so amazing, but also is probably prone to, well, the distance is something to, come over. So in your work, do you also look at, let's say, telemedicine, or how do you connect to the patients with your research in the university and the specific application to tuberculosis and malaria, helping the people in the field?
Thank you very much, Alan. Apparently, the nature of healthcare systems here are in person, where we usually have patients sometimes walking long distances to access healthy facilities, and that's one of the major challenges that we have here. Not only just healthy facilities being so far, but also the number of health professions are very, very few. when you take a statistic, especially around pathologists in Uganda, we have just around 24, and that's a number that's less than 30 pathologists in the entire country. So if you have patients that are coming from all over the country to just access the few medical professions to attend to them, that even becomes, a very bigger challenge, especially to have patients receive the best care that they need. Through the Ocular project, where we are harnessing the use of artificial intelligence to support disease diagnostics, we trying to come up with the platforms, especially the mobile applications, and also the web-based applications to be able to support, especially in areas where we have or we don't even have healthy practitioners to assess medical imagery. The way we are doing this is that we are developing for microscopy, if I'm to use that such as a use case, is that we've developed a 3D printable adapter that we are attaching on the eyepiece of the microscope to be able to capture an image onto the smartphone. Now, if this is connected to an internet facility, we believe that anywhere a pathologist can be able to look at what the artificial intelligence model is doing and give, the necessary recommendations and final decisions onto that. And we believe that that is, one kind of a step that we believe that will be a step forward in helping around the challenge of the few trained professionals that we have to make sure that healthcare reaches even in scenarios or situations or areas where we don't even have a medical practitioner there. So we believe that through our platform, telemedicine services will be available to counter the few practitioners that we have around us here.
Right. Thank you so much for your mission to help and scale this solution, Rose. Now, you're a researcher, and Elizabeth, you work with researchers and their feedbacks and how you can help them. So maybe share with us a little bit, what are maybe some surprising things or revelations in your work with researchers?
Yeah, it's a great question. So I think what for us has been really interesting, right, is seeing a lot of the elements of the research process have stayed stable over time. So we've had an over 140-year history where we've operated at that intersection between scholarly information and delivering it to folks at the sort of point of decision. Remember when journals and books were the main delivery mechanism, and then digital, and now it's data and insights. But what's changing and continues to change is the exponential growth in information that researchers and scholars and clinicians need to manage, understand, find the right insights within to be able to progress their work. There's over 5.14 million articles published every year, and that rate is doubling every 10 to 15 years. We see the impact on individual researchers. It's very taxing, in particular at the early stages of research questions. So one example that comes to mind is Dr. Anji El-Sawaf. She's a pharmacology lecturer assistant in Egypt, and she researches neuropathy, which is a common side effect of chemotherapy that can be so severe that patients choose to stop their cancer treatment. And she's telling us in a user session, it's extremely hard for people, right? It can have a really big impact on quality of life. So if you can find solutions to decrease the pain even a little bit, it can make a big difference to them during their treatment. So this, as you can imagine, is really motivating for Anji. However, the evolving nature of her field and the ever-growing corpus of scholarly information she needs to digest to keep making that progress in her work means that it can be quite overwhelming. So she's actually explored, and we've seen many researchers do this, using ChatGPT to try and sort through and find where are those gems, right? Those pieces of information that can help them move forward. However, they know it's not trusted, it's ripe with hallucination. There are a lot of challenges, and you don't get the cited scholarly literature, which is the critical building block of being able to progress your work. So when we tested Scopus AI with her, it was really, really heartening to see that she was able to actually incorporate it into her workflow fairly seamlessly. And now she uses it on a daily basis. And through interviews with people like Anji, we learned that for over 60% of the researcher population, it's really that coming up to speed on a new topic and finding the essential information in that sea of scholarly literature that can slow or even stop a research process in its tracks. So that's where we chose to really focus our efforts with generative AI on information retrieval, really getting as good at it as we could, such that scholars can trust us that they're actually able to work with that algorithm as if it were a trusted kind of scholarly guide like themselves, that we could actually make a big difference in helping people move forward past that kind of intro point into their field or their project.
Yeah, I like what you mentioned before, that you are the trusted source and the citations are in there versus hallucination. I think that's a good point. Now, we're talking about AI, we're talking about health, and we will dig into this in a second. Before this, I just wanted to, get to know you also a little bit more, and because there's always a human factor in driving these initiatives, and we see here, obviously, with all you three, how you do this and what are you doing. So maybe share with us when and how did you start towards your current mission? So was there maybe a trigger point? What brought you into your role today, Cristina?
Yeah, definitely. So healthcare has always been my passion. I studied biochemistry and pharmaceutical science in Mexico, and then had an opportunity to do a master's in bioscience enterprise at the University of Cambridge in the United Kingdom. And I've dedicated most of my professional life on seeing how we can transform ideas into commercial products that we will actually have an impact in healthcare. I started my career first as a consultant at McKinsey and Company, where I had the chance to do many projects involving public healthcare, pharma, medical devices. So really had the great opportunity to get a scope of the different players and the different strategies needed in order to all be able to provide or address these healthcare challenges. And it was 4 years and a half in January 2020 that I got the chance to leverage this background in healthcare and business with my co-founder's background in and knowledge in artificial intelligence. My co-founder is Alejandro Noriega, and he has a PhD in AI from the MIT. So we combine both of these knowledges to create PROSPERiA with this mission of using technology, and particularly artificial intelligence, to improve access to high quality services in emerging markets like Mexico. And as I mentioned, first we started very focused in diabetic retinopathy, because they're like, okay, yeah, we want to use AI to help improve access to healthcare, but of course there's many challenges and many things that you can focus on. So we decided to start with a very tangible, concrete, and big problem here in Mexico, that is diabetic blindness. And with that, we created Retinia, that is our first solution, in which we are able to take a picture from the back of the eye, of the retina, and scan this picture with algorithms, with machine vision, in order to detect patterns related to several conditions. And so far, I'm very happy to say that we've screened over 60,000 patients here in Mexico.
Wow.
And with the images of these patients, we have been able to improve the precision of our current algorithms, but also train more algorithms to be able to detect other causes of blindness. So right now, we're able to detect the top causes of blindness, such as glaucoma, macular degeneration, cataracts, and really be able to provide more value to our patients.
All right, you drifted from your personal mission right away in your company, so let's stick to your personal ways. Rose, if you think about, how did you start into getting the role where you're in right now? What made you tick to move what you're doing right now?
Thank you very much. Part of my personal mission, and as well as the work that we're doing here with the team, is fueled and motivated by some of the societal challenges that we face in our context, and that is one of the visions that we have. When you look at most of the pressing diseases that we're actually handling in our context, especially malaria, you'd realize that globally it's almost the third contributor to the malaria burden all over the country, all over the world. So you see that we have a very big healthy challenge here in Uganda and the entire sub-Saharan Africa. So those are some of the motivating factors that push us to involve more of the expertise that we have. While I was undertaking the computer vision class way back in 2016, there happened to be a conference where we interfaced with medical practitioners. And while we were having a conversation, one of their pressing needs was, we have so many patients that come to most of these healthy facilities for just a single diagnostics. Now, when it goes even further to the remote facilities, you may even barely find a medical practitioner to be able to attend to them. So most of them, the diagnostics is just based on just symptoms. So when you looked at those kinds of burdens and looking at the environment under which we're operating, apparently we had statistically more microscopes, especially at the healthy facilities, vis-a-vis the number of trained technicians in those healthy facilities. So the idea was, could we be able to leverage the capabilities of artificial intelligence to be able to support the derailing medical systems that we have here? And that was one of the major pushing and motivating factor, even up to now, that we have a duty to play now that we have capabilities of technologies to support our medical facilities to be able to improve patient care. So if you ask me what was the major moving factor, that was one of them. When it gets to diseases like malaria, almost each of us in Uganda has ever had malaria. And I know that Harold, you said that you've ever been in Uganda, and those statistics speak right. When you go to the pathology department, we have very many mortality rates that are happening, with Uganda being the 7th contributor to the highest number of cancers in the entire world. So you see there is a very huge burden, and as in our capacity where we can be able to come in, we believe that that is always at the top of our radar to be able to support in ways that we can. And I want to thank the capabilities of artificial intelligence that have come in, the compute preferences that are coming in. We just want to have good policies and governance to push the agenda forward so that we can be a part of that building block to reducing some of the major health challenges in our context. Thank you.
Yeah, very well. I can only imagine. I mean, if when I traveled to Uganda, I had the luxury to have a malaria medication, and taking it for a week was already so, crazy or cumbersome. And friends who unfortunately got malaria just tell me how devastating it is, and we see the cases in the data. So thank you for your work. I think it's very, very important. Now, Elizabeth, what kind of, what brought you to where you are today? What's your mission in this?
Yeah, it's a great question. So the benefit of being able to answer this in 2 to 3 minutes is that it's going to look a lot more straightforward than it actually was. It was quite a winding path, as I'm sure it was for all of us. But I'd say it's probably the intersection of two things, which is a particular type of idea and then a particular type of channel to get that idea out there that ultimately framed where I am today. So on the idea, I set out studying highly interdisciplinary stuff. When I went from physics and kind of hard sciences into thinking, okay, the biggest pressing problems we have today are only going to be addressed at the intersection of a lot of different fields. So you can't address climate change without physical science, climate science, soil science, but you also need really, really heavy doses of cultural understanding, sociological understanding. You need policy, you need the history of government, right? It's really, really difficult. And I was searching around for what's the type of field that can give this type of mixture. And there are quite a few of them, geography, development sociology, and other really important fields. However, the interdisciplinary research at that time wasn't particularly well formed. So there wasn't a very clear path forward to something that was really practical and tactical. So in another part of my research was looking at something called socially responsible business. It's sort of a model that's alternate to CSR, in that you build revenue delivery back to the communities in which the business sits, rather than having it be reliant on donation cycles and grant applications and that type of administrative work. And I found that to be a really powerful way of bringing ideas into reality and making actual change in communities in areas where I was studying, like South Asia and parts of Central and South America. So bringing all of this back, I had thought about different paths of taking some of these ideas, which can be highly theoretical and scholarly in nature, forward into the world in ways where they could make kind of scalable change. And I found the university system in the US at the time not to be necessarily the best catalyst, because we needed really that, we call it the triple helix sometimes, right? It's the government, the policymakers, as well as for-profit businesses and universities, right, as the sort of nexus of those ideas. And I think that's ultimately what brought me to Elsevier, which again is at that nexus of kind of supporting really the trusted scholarly ideas and communication with great integrity forward into a space where it can be communicated, it can be acted upon, it can be interpreted by groups in the world like funders who are trying to decide, okay, what's the next big topic where we actually want to drive our policymakers and our universities at scale in what direction, for greater societal change. And I think that's ultimately what brought me here today, and a lot of the other wonderful team members that work with us, I think, feel very similarly.
So now, obviously, we talk about AI, and we have talked about some of the things that are in your works, but where do you think AI can benefit the most? Either in your specific case and or from your point of view. Cristina, we start again with you.
Yeah, thank you very much. I'm actually, as it was being discussed on the last panel, I think that, yeah, this is just the beginning of AI, and I'm very excited about all the future opportunities that it can do. I think particularly in my field, I know that there's an enormous amount of opportunities to leverage AI to tackle healthcare challenges. I think particularly how we can help enhance healthcare operations. For instance, in Latin America, we face significant challenges such as saturated hospital, inefficient process, supply chain disruptions. And I think here AI can really help optimize all those processes, be able to take less demand of healthcare professionals and be able to sort of screen and segment and follow up with patients without the need of these healthcare professionals. And then I'm really most excited about the bundles that we can create with AI and clinicians and nurses, because I don't believe that AI will substitute them all. It will be able to sort of provide the healthcare attention that patients require. But I think the mixture of having both is where you get the most opportunities and more precise results for patients, but also how you can address this shortage of healthcare professionals and have really qualified people doing more of the treatment, of the human engagement with the patients, and leaving the AI do more of the admin, the screening, the follow-ups, the admin stuff that nobody really wants to do. So I think I'm very excited on that path forward for AI. And of course, there's also a very important considerations that we have to take into account so that we can continue to develop and implement AI in a responsible and ethical manner, because I'm sure that it can also enhance the bridge that we see already within populations in emerging markets, where saying like who has access to these resources, and therefore we need to enhance the politics, the infrastructure, the regulatory pathways to make sure that this is really addressable to all, applicable to all, and be able to really leverage the power that AI can have.
So you say for every fake picture created, we should dedicate NVIDIA time for image recognition for doing good. If I summarize you hopefully correctly. Okay, cool.
Exactly. Yeah, definitely.
We're looking at the time. So Rose, what do you think? Where is AI helping you the most, or can be beneficial?
Apparently we're using it more for diagnostics, and I believe it has had a tremendous and transformative role in promoting better diagnostics. Especially, we have evidence for that, and I'm glad that artificial intelligence is able to support on that realm. But more to it is that one of the challenges that we found is that when you look at medication or care or treatment, sometimes we have different individuals reacting differently to different cares and different treatments. But with the power of artificial intelligence, we believe that more of it could be leveraged in personalizing treatments to be able to provide that kind of personalized care for a patient in a more effective manner. And we believe that that's one of the ways that we can be able to leverage artificial intelligence to make recommendations, especially better personalized decisions to a given patient in addressing concerns about well, I have a different genomic setup, I have a different DNA. So if we have artificial intelligence coming, we believe that it will be a very big leap to personalizing care and treatment. And I believe that's one great way that it can be able to, support in that. Recently, we've had Google coming up with the Polygemma models that are for multimodal medical reporting, whereby now practitioners don't need to, interpret images. An artificial intelligence model can be able to, interpret image to text, and that's very, very interesting. That that information can even be leveraged in local languages, and that there we can even see the power of generative AI at play. I mean, it becomes so easy to interpret diverse and complex medical imagery into languages that people can be able to understand, but also practitioners to not waste a lot of time looking at. So we see that artificial intelligence has a very big potential to improve patient outcomes. We've seen it work around virtual assistants for patient engagements. I mean, we can see these AI technologies gaining traction in enhancing patient engagements and self-care. So without even having a medical personnel physically available through virtual assistants, we believe that that's one way that artificial intelligence can be able to revolutionize patient care by having, a virtual assistant standing in especially absence of a physical medical doctor, though we can't just underscore the presence of the presence of this physical touch, especially we know that it's very important in patient care, but through scenarios where we don't have even a medical practitioner at hand, we believe that virtual assistants can play a very good role in providing seamless patient care. Thank you.
Great. Elizabeth, you have 1 minute for your answer before we have another last minute for a 1 second answer from everybody to the last question. So where do you see the biggest benefit?
Yeah, great point. I think we see it reducing friction, kind of hastening speed to impact and innovation in the research process. And I think the introduction of more LLMs, cost efficiencies, and agentic frameworks, I think means that we'll be able to put it into more locations around the research process. Maybe we're thinking about research strategy and planning down to articulating your impact and then connecting those things together so that you can be more deliberate in pointing your research enterprise toward the impact that you want to have. But I'll leave it there for now. I think there's a lot of exciting opportunities to come.
Now, we saw Apple introduced something that will be in every phone soon. In the next 5 years, the singularity is near, but also sustainability goals have to be achieved by 2030. We have so much to do and on the plate for the next, before this decade is out. So your 1 sentence answer, what do you see, where do you see generative AI for health in the next 5 years? So again, Cristina, Rose, Elizabeth. Next 5 years. Become a futurist. Tell me.
I'm becoming futurist. I think sort of like related to what I was saying in my last answer, I think I'm excited in the next 5 years that we will see a lot more integration of AI with human attention. And I think it would be sort of innate in the way that we process things, like in our phones, in our computers, in our workplace. Everything I think we will do would be enhanced and empowered by AI. And I still have like an optimist, futuristic view on the AI, and saying that I don't think AI will replace humans in most of the
Okay, one sentence is over. I have to watch. Okay, thank you for that, Rose.
No.
Because we have the other people all lined up for the next panel. Rose, one sentence. Where do you see generative AI in the next 5 years?
In the next 5 years, I see a good uptake of integration of AI models into most of the clinical workflows, while we're addressing concerns, especially about patient privacy, but also not forgetting that artificial intelligence is just going to be a support tool. We always need to have a human in the group to always give the final decision of what the AI always comes up with. Thank you.
All right, Elizabeth, now bring it home.
Generative AI will have more solutions than we know what to do with, but ultimately our problems remain quite similar to what they always have been. We need a model of university, government, private sector partnership that's able to deliver things like measurable societal improvements against our biggest challenges. I encourage you guys to look at the Tasmanian Societal Impact Model Playbook, which explores ways to amplify and measure societal impact. It's guided by the UN SDGs. It's free for adaptation and use, and it gives us a guiding principle and framework to build a more sustainable society and economy. Gen AI will absolutely be an accelerator and a tool, but we need guidelines and collaboration to work together to really amplify its impacts.
Awesome. Thank you for the tip. Thank you all very much. It was really exciting to see. And also, I love that we saw, your input from Mexico, your input from Uganda, and obviously combined with Elsevier's vast database of knowledge. So I think my takeaway is that we should look not only at Silicon Valley to develop all these big models, but we should, and I feel there's always something like AI right now is doing a lot of answers, but we don't have to forget about the question and the challenges. So thank you so much for giving us some insights about the real world out there. And again, maybe there's a model. First of all, I think, Cristina, you also said it. Let's look at ethics. Let's look at the right tools. Elizabeth, of course, we have to have citations and proper sources so that we don't hallucinate. And over also to Rose, like we have to have access to these tools also in a worldwide scale. So let's do less, fake images, bring more of the power of AI to all the real questions and challenges around the world. Thank you so much. It has been a pleasure to speak with you all, and see you next time. Over to Jivi.
Wonderful. That was a power-packed session. Harold, Cristina, Rose, and Elizabeth, that collective intellectual firepower in the virtual room was very palpable. It's clear just how passionate Harold and his panelists were and are about finding meaning in technology, but those really concrete kind of measures rather than it being sort of very generalized, and exploring that leadership for regenerative futures, sustainability, but understanding exponential innovation in tech and its opportunities for society, for companies, for entrepreneurs. So that was really, really interesting.